afternoon everyone. Myself, Dr. Akshada Guzar, working as an assistant professor and welcoming all of you on behalf of Honorable Principal Dr. Shyama Bhakre and Department of Panchakarma, MES Ayurved Mahavidyalaya, Ghane Gunto Lote, Khed. Now, we are to conduct a national webinar on Shirodhara in clinical practice. On this occasion, we are blessed to have Dr. Jigeesh sir as a guest lecturer. Now, I am going to introduce Dr. Jigeesh sir. Sir is currently working as a professor and HOD in Department of Panchakarma, VPSV Ayurved College, Kottakkal. Sir has completed his BMS from Vaidyaratnam Ayurved College, Allur, and sir postgraduate from Government Ayurved College, Trivandrum, and PhD from SCSVMB University, Kanchipuram. He is the member of PG Medical Board of Studies, Kerala University of Health Sciences, and the member of PG Board of Studies, Calicut University. He has delivered lecture in many national and international seminars as well as webinar. Sir has good expertise in neurodegenerative cases and well experienced in Panchakarma as well as Kerala Kriya Karma. And sir has published many research articles in national and international journals. Now, I am requesting to sir, please enlighten us with your expert thoughts. Thank you, sir. Sir, can you hear me?
Yes, I don't know why my PPT got hanged.
Okay, sir.
Just a minute.
Okay, sir. Thank you, sir.
Maybe it contains some pictures also.
Okay, sir. No issues, sir. You can take your time. It's okay.
It is showing that the host is. Okay. Please allow me to share the screen.
Oh, sure, sir. 1 minute. I will attend. Your name? Sir, can you please check, sir?
Showing disabled.
Can you please check now, sir?
Yes, now it's
Okay, sir.
Is it visible?
Yes, sir, visible. You can start, sir.
The most respected Sachin Ulpal sir, my favorite student Dr. Ashwati, and all other respected dignitaries and dear friends. I'm very happy to be here in this platform to speak about Shirodhara in clinical practice. So I'll be concentrating on the practical aspects mostly. If we go into the theoretical aspects of Murtha Taila Prayoga, it will take a lot of time. It has a strong theoretical foundation for developing these procedures, Murtha Taila procedures. So I will be skipping those areas. If time permits, I can go to the details. So when we think about the traditional knowledge systems in Kerala, we can see that there are rich traditions in different branches of Ayurveda, like Balajigilsa, Vishajigilsa, etc., Netrajigilsa. So these branches, certain branches have been developed considerably in the earlier days. So we have many textbooks written in Kerala language which contains a lot of information. If we see the contents of those texts, we can see that they have been built on strong theoretical foundations. It is perfectly based on the Ayurvedic principles. They have not violated the principles. So without violating the principles, Tridosha, Siddhanta, etc., they have developed these branches. And of course, everybody will be knowing Kerala has its rich biological and cultural heritage, and definitely this might have developed the development, helped to the development of such a system in Kerala. So when we think about how Kerala became popular in Ayurveda, when we go to the evolution of Ayurveda or the development of Ayurveda in Kerala, we can see that two chances are. One is Ayurveda came in Kerala, then the ancient physicians or the physicians who were practicing in those days, they developed different procedures, and thus the current status of the Ayurveda obtained. There is another concept that already there was a system, an indigenous practice of indigenous health tradition was there in Kerala. So when Ayurveda came to Kerala, these two systems got mixed and they developed further. So we have many textual evidences and many traditional or experience-based practices in Kerala. Different texts even in Sanskrit, some Sanskrit textbooks are there. Then a lot of textbooks written in Malayalam is also available, which deals with even some Panchakarma texts are available like Dharakalpa, Shiraseka, Viti, Keraliya Kriya Krama, etc. Apart from this, as usual, what we observe in the 19th or 20th century, we have a lot of a compendium of formulations. These are also available in Malayalam. There are certain commentaries with the critical annotations also. Even for Ashtanga Hridaya, some Sanskrit and Malayalam commentaries are available, which are worthy to read. When we come to the procedures, we can see that there are some practice-based operative procedures and some ethnographic practices. So there was a focus group discussion on evolution of Dhara. So how the current method of practice has been developed. So that by time it has been developed, and there are no references for some of the things which are practiced even now. There are some ethnographic practices which are prevailing in Kerala. When we go to the contributions of Kerala, we can see that they have identified some new pathologies. I'm not going to the details of this. There are many things to be explained under this. There are some conditions explained in some Kerala textbooks which are not seen in any other classical textbooks. Even though he says that his previous acharyas like Kashyapa, Harita or Hindu, etc., nowhere you can see these pathologies. There are some different pathologies, especially explained in Arogya Raksha Kalpadrima, which is a textbook written by Kaikulangara Ramavarya, who was a well-known Pandit, Sanskrit Pandit, and also a famous physician in Kerala. So in his book, he has identified many new pathologies, many new diseases, and he has explained these diseases purely based on Ayurvedic principles. And even the pathologies explained in the classical textbooks like Ashtanga Hridaya, he has tried to modify these pathologies according to these new theories. And new nomenclature for diseases are also seen in this. And coming to Panchakarma, we can see that many new procedures are seen in the Kerala, modified formulations, new formulations and preparations. Say for example, for Virechana, in some textbooks like Chikilsa Manjari, there is a chapter for Virechana drugs in Udara, which contains a lot of new formulations and also new preparations also, which are not explained in the classical textbooks. And there is high specificity in the selection of drugs for the procedures, especially in the case of Pindasveda. You can see the selection is varied according to the disease or according to the stage also. So coming to the medications on heads, we can see that the Kerala contributions like the evolution of a systematic approach in procedures and utilization of regional plant resources, creation of new formulations and exploration of transplanting. So we get references of Shiroleba, Shiraseka, etc. in classical text. When we go to the Shirogadavada or when we go to the Shirashula, etc., you will get many references of Shiroleba and Shiraseka in the classical text. But how these procedures have to be done, these are not explained. Apart from Shirovasti, we won't get any reference regarding the operative procedure of other Murtha Taila Prayogas. When we come to some Kerala textbooks, you will get a clear-cut reference of many things, what explained, what practiced, even nowadays. So coming to Murtha Taila, these are some of the basic things. That is the application of Taila over the head. Shirasi yat Tailam diyade tat Murtha Tailam uchide. There are 4 methods, that is Abhyanga, Sega, Piju, Vasti. Synonyms: Murtni Taila, Mastishkya, etc. Shirasa Tarpanam, Shirasa Pradibhuvanam. These are explained in different contexts. Definitely it is a Snehana Karma. It comes under the Vijarana or Bhakya Snehana. Sometimes it is also taken as a Bheshaja Marga. This from practice or the Kerala practice I am saying. In some conditions, when it is impossible to give in other routes, this Murtha Taila route is adopted. Even some systemic diseases, we can see the application of different medicines over the head. So it can be considered as a Bheshaja Marga. Of course, there are 5 procedures which are known as, collectively called as Keraliya Kriyakrama. Murtha Sega, Pindasveda, Annalebana, Shirolepa. So these procedures are Murtha Sega, Kaya Sega also, then Pindasveda, Annalebana, Shirolepa. So these 5 procedures are collectively known as Keraliya Kriyakrama. Somebody call it as Keraliya Panchakarma, but it is a misnomer. It can be considered as Keraliya Kriyakrama. These 5 procedures were well flourished, well practiced in those days. That may be depending on the conditions. So collectively these 5 procedures are called as Keraliya Kriyakramas. So Murtha Sega is one of the Keraliya Kriyakramas. So as I told, Abhyanga, Sega, Piju, Vasti, the potency increases in the ascending order. When we come to the practice, we can see that it is in the descending order. Mostly we practice the Shiro Abhyanga, then Sega is practiced, then Piju, and Shirovasti is least practice. As far as the practice is concerned, it is like that. But coming to the potency, it increases in the ascending order. So Shirovasti has the maximum potency, and the Shiro Abhyanga is having the least potency. But this depends on the absolute indication of Taila Prayoga in Vada. This is based on that, because Shirovasti means it contains more Taila and also it produces retention. So it is more Vadhana. Whereas Abhyanga means we use only little oil. So comparatively, we can say that it is less Vadahara. Of course, it is Vadahara, it is Snigdha Prayoga. But compared to Shirovasti, the amount of Taila and the retention, etc., are minimum in Shirovabhyanga. So, considering the Snigdhada or Vadaharatva of the procedure, Shirovasti will be having the most Vadahara property. Even though it is mentioned, all 4 procedures have specific indications. So, Abhyanga is indicated in Drukshada, Kandu, Mala, etc. You can see that Kandu, Mala, these are Kaphaja Vigaras. So, when there is a Vada Kapha vitiation or when there is a Kapha associated Vada Gopa, Abhyanga is advised. When there is Pitta association or Pitta Kapha association, we can see that Sega is indicated. Arukshiga, Daha, Paga, Vrana, Kleda. These conditions are Kapha Vaitika. So in these conditions, especially Sega is indicated. Piju, we can consider that it is indicated in Vada Pitta. Kesha Shada, Spudana, Dhubana. These are the conditions which are ideal for Piju Dharana. So they are mostly Vata Pitta conditions. So Pichu is indicated in Vata Pitta conditions, whereas Vasti is indicated in pure Vata conditions. Gambhira Dhadugata Vata Gopa, Prasupti, Artida, Nidranasha, Nasa Shosha, Asa Shosha, Timida, Shirodhara, etc. So these procedures, we can see that there is a difference in the condition of dosha. So Abhinga is indicated in Vata Kaphaja, Sega is indicated in Pitta Kaphaja, Pichu is indicated in Vata Pitta, and Vasti is indicated in Kevala Vata conditions. Of course, the practice there may be difference, but as far as the classics is concerned, it is like that. Coming to Shirasega. So Sega means that is the pouring of lukewarm liquids like Vasa, Taila, etc. And when it is done over the Murtha, it is called as Shirasega. Especially it is indicated in these conditions, Sarunshika, Shirastoda, Daha, Varga, Pranation. And as I told, we will get the references of Sega, Shirasega in the classical text, but nowhere the method of procedure is explained. So these details, the method of procedure will be obtained in Kerala textbooks, and they have developed as a potential therapy with wide clinical applications. These are some general indications, or generally what we get in the hospital. Cerebrovascular disorders, cerebrovascular accidents, atrophic brain where there is cortical atrophy, etc. Neurodegenerative diseases, seizures, psychiatric disorders, etc. Even though the Tailadhara, I have given these in the Tailadhara indications, Avastha is the most important one. Neurodegenerative diseases I have included, or in other conditions also. Even though it is indicated, it should be done in its stage only. Generally, in the neurodegenerative cases, the initial stages are not indicated for Tailadhara. Generally, we go for Tailadhara only in the last phase. Say, for example, sometimes the patient will be admitted for 2-3 times, means with a 6 months or 1 year gap. So the Tailadhara we usually advise in the second or third course only. So in the initial courses it is not done. In some of the neurodegenerative diseases like Parkinson's disease, etc. But in Pakshaghata, etc., directly we go for Tailadhara. So coming to the standard operative procedures. So first educate the patients. So give the details of the procedure to the patient, how the patient should cooperate, how the patient should behave, what are the things the patient has to follow. This should be well explained. The patient will not have any idea about the head bath, etc., about the medicines, how it should be done. So these things we have to explain first. So then obtain informed consent. It's also necessary. Then ask the patient to remove or cut short hairs. So better shave the hairs, remove the hairs, that will be ideal, or make it short. Then ask the patient to satisfy the natural urges, ensure the fitness also. This is also important. Even though the procedure is indicated, sometimes on the day of the procedure there may be some contraindication. Okay, it is a Pakshaghata case, so Shirodhara is indicated or Murtha Taila is indicated, but on the day of procedure the patient develops fever. Then there can be contraindication for Shirodhara. So every day the fitness should be verified. Then ask the patient to sit on the droni with the legs well extended. So droni, etc., you will be knowing. So ask the patient to sit on the droni with the legs extended. Then apply some Taila over the vertex. Taila, mostly it will be the Taila used for Dhara. There are some practices, some rare practices where some different oil is selected for initial application. That is rare. Don't consider it as a most important thing. generally we can take the same taila over the head, then do abhyanga all over the body with the warm taila for 10 minutes. So apply taila all over the body and make a abhyanga for 10 minutes. Then tie a cotton band around the forehead, okay, just above the eyebrows. So make a band, then ask the patient to lie supine on the drowning. Then cover the eyes with the cotton gauze and keep cotton plugs in the ears. This to prevent the spillover of taila to eyes or ear. So just cover the eyes with the cotton gauze. Then position the patient so that the tip of wig comes 6 to 8 centimeter above mid portion of the forehead. So usually the dhara is poured in the mid portion of the forehead, or we can take just above the wig, just above the varti, which usually we tie just above the eyebrows. Just above that, the pouring of the oil should be done. So as per the text, dharocham chadurangulam, it should be 4 finger above the head, above the forehead. So the height of varti, that should be 4 angulam from head. Then warm the taila to 38 to 39 degrees Celsius. That is sufficient. Lukewarm oil only used. Only in Shirovasti, Koshna, Ushna taila is indicated. That also Koshna, that is only mild temperature. On head, hot applications are generally contraindicated. So, warm the taila to 38 or 39 degree maximum. Then hold the dhara vessel little away from the head. So, so lie the patient in the supine position. Then make the dhara clear. So pour the just hold the vessel away from the head of the patient. Then pour the oil into the dhara vessel carefully. Then make the dhara uniform. Make the dhara clear. Then bring back dhara vessel above the head. Okay. Then direct the dhara coming through the wig into patient's forehead. So adjust the thickness of wig so as to make the thickness of dhara equal to thickness of small finger. So Kanishta Anguli, that is mentioned. So the thickness should be equal to that of small finger. Okay. This here you can see in the picture. So this is the conventionally practiced. So a coconut shell will be placed inside this. Serrated coconut shell will be placed. From that, the wig will be tied, and the wig will be coming out through this hole. Okay. So this is the conventional method. Nowadays, the dhara unit is available, so that it is more easy to operate, but it has its own demerits that I will tell later. So maintain continuous and steady stream. Yeah. Kanishtika Anguli Parinahonmidam Yoginaha. It is from Dharakalpa. From in the Dharakalpa it is mentioned. It should be equal to the Kanishtika Anguli. Maintain continuous and steady stream. So generally we advise 1 or 2, minimum 1.5 liter, or better to take 3 liters, so that you can have a continuous and steady stream of dhara. So oscillate the vessel with a moderate speed from one end of forehead to other with the right hand. So that is the method. With the right hand, it is oscillated. Pijubadha laladasya bahirbandhal prajalayan pichogram shankhayor madhye shirodeshe yathasukam. It is from Hridaya Priya. Hridaya Priya, it is a Sanskrit textbook written by a Kerala scholar, Vaikyam Parchimuttal. So in that this method has been explained, how the dhara has to be done. So, Pijubakha Laladasya Bahirbandhal Prajalayan Pichwagram Shankhayor Madhi Shirodeshe Yathasuna. So, maintain uniform rate of oscillations throughout the procedure. So, the oscillation should be uniform. Should not be too speedy, should not be too slow. So maintain the temperature of the thyla by reheating on getting cold. If the thyla gets cold, again reheat it and do the dhara again. Do the oscillations. Do gentle massage overhead frequently with the left hand. Some 5 minutes gap, just massage the head. That's also carried out. Continue the procedure up to 45 to 90 minutes. This is generally carried. Mostly for the procedures, 1 muhurta to 2 muhurta, that is explained. 1 muhurta means usually it is taken as 45 minutes or maximum 90 minutes also dhara can be done. Then ask the patient to flex his lower limb occasionally during the procedure. While doing the dhara also, just ask the patient to flex and relax the lower limbs. Then hold the dhara vessel away from the patient head. After completing the dhara, just hold the dhara vessel away from the patient head. Remove the cotton band, gauze and plug. So from the patient's ear and ear, remove the cotton band, cotton plug, and also remove the cotton band also. Then wipe off oil and sweat with a clean and dry towel. So clean the head, then ask the patient to sit and apply Rasnadi Churna on buttocks. And then ask the patient to take rest for 1 hour with the body covered with a blanket. Advised to take bath in warm medicated water. Bathing is advised. After dhara, bathing can be had. Then explain Pathyabhya. According to the disease, according to the procedure, address the Pathyabhya. Generally, the Snehajara is indicated. So, this height that is explained as 4 angula, it should be from 4 angula only. If the height is more, it can cause the fever, headache, burning sensation, etc. And if the height is too low, it can cause aggravation of symptoms. There are some references like in Pitta conditions, low height is preferred, and Kapha conditions, more height is preferred. There are some references in some Kerala text. Generally, we follow the 4 angula pattern. Then the Atyartha Vilambita Druta, that is also contraindicated. If it is over speed, it can cause Vadagopa, it can create headache, fainting. If it is low speed, it can cause Kapha, Shirogaurava, etc. Patient will tell that. So even though the procedure has been explained as just oscillations, there are many things to be taken into consideration how the oscillation is done. So it should not be too fast, it should not be too slow. So in that manner it should be done, and also it should be from the 4 angula height also. There are some studies in IIT Madras. They have conducted some studies in which they have studied the impact force of thyla and different materials over the head in the Shirodhara, and they have found that impact force is different in different meanings. So it may have some action. So that will be the that should be very carefully taken into consideration. Then Kanishtika Madhyamana is also the thickness should be equal to the that of a small finger. If the thickness is more, it can create headache, fever, etc. If the thickness is very low, it can cause penasa, low efficacy, etc. So this is what I told. This is a modified Shirodhara Yantra which is available now. You can see here the hole is very small, whereas this usually comes to that of small finger. So this is the conventional one. So if the diameter is too short, that can create some complications. It should be in a dhara pattern. It should be in a continuous stream. If it is interrupted, again, it may have some impact on the symptoms. And some other symptoms like a headache, etc. may come. So while doing the procedure, in the course, we have to inquire about how the patient feels. So daily we have to observe the symptoms. If any additional symptoms occurs, if the patient feels any complaints, any difficulties, then if the patient present with some difficulties, these factors should be borne in mind. So that should be taken in. Okay. So whether there is any fault in the arrangement of dhara, in the thickness, in the height, in the speed, etc. So this is a reference from the text called the Shirasegadividhi, which is written by Pudiyadatta Raman Menon, in which the dhara procedure has been explained. So these two, that is, these are Malayalam letters, dharaya padana drepha kagarova yatha bhave. How the ka is written, in that manner dhara has to be done, or in the manner of letter ra. So this is explained in the text. Earlier there is a practice of doing this method in the method of ra. So the one to one side it will be going through the mid portion of the forehead, and the other will be coming through the scalp also. Like that ra is written. So that was practiced in Mahavidyalaya Kottakkal earlier. But nowadays this the similar oscillations are done. So that's the practice. Before going to the Murtha Daila, except Shirobhyanga, I can tell, in all other procedures, always it is better to have Shirashuddhi. Before doing Shirasega or Shirovasti or including Shiropichu, it is better to obtain Shirashuddhi by Nasya. In the case of Shirovasti, it is explained that both Adhakaya Shuddhi and Urdhvakaya Shuddhi should be obtained. So after performing Adhakaya Shuddhi through Vamana, Virejana or Vasti, then completing Urdhva Shuddhi through Nasya, Shirovasti has to be done. Actually, this is applicable to all other procedures also. Basically, this is a Snehana procedure. So it can be taken as a Brahmana procedure or Tarpana procedure. So before giving a Brahmana procedure, the srodhases should be open, should be cleaned. So for that, always it is better to practice a course of Nasya, minimum 3 days. 3 days, 5 days or 7 days Nasya before doing the Shirodhara, which will definitely improve the effects of Shirodhara. So generally we practice a course of Nasya, minimum 3 days just before Dhara. Duration already I explained, 45 minutes to 90 minutes. Then maximum 21 days. There are some references in the textbooks, but in general practice, 7 to 14 days it is considered. So these are the merits of Shirodhara: Stairyam, Vang Manaso, Sharira Balam Apyahara Kamsham Priti, Madhuryam, Vajasas, Tvajobi, Uda Netre Pragasho Gata, Shuklasrik Pariposhanam, Hedaradir Dirkayuralposhnada, Suswapnam, Gradataila Sejana Gudayana Astini, Jagrasana. It is explained in Dhara Kalpa. So it produces the Stairya to Vak and Manas. So it produces the Sthirata of Vak and sthirata of mind also, improves the sharira bala, it improves the ahara kamsha, then dhriti, then madhvidya. So the speech, the different aspects of speech will be improved. The mrududa, tvajobi mrududa, the mrududa of the skin, netra pragasho gata, the netra will be more, will be having more active. Shuklasrak Pariposhanam, Netaradir Dirkayur Alposhnada, Suswapnam Krata Taila Sejanam Gunainastini, Jactors. So that's about the procedure. So just I will be going through some formulations which are usually used over the head. Not only for Shirasega, for Shiro Abhyanga also some of the formulations are used. So I will be just introducing these formulations. These are available in Kerala market. All the formulations, whatever I am going to mention, they are available in Kerala market or in the Kerala pharmacies. You will get all the formulations.
Okay.
Coming to the Amritadi type. So I have explained the procedure. So the procedure has to be selected based on the condition of the disease or condition of the patient also. So a Snigdha procedure, Snigdha Parishega, as I explained, it should be done only in the last phase. Generally it is like that. So once we obtain the Niramada, then only we have to think of the Snigdha procedures. So in different conditions like Vadarakta, etc. So initially we will have to think of whether it is a Sama, Nirama, etc. If it is a Sama, accordingly we have to manage. And after that, after making Nirama, Adhakaya Shuddhi should be done. If dosha is there, Adhakaya Shuddhi should be done. After that, we have to perform the Urdhvakaya Shuddhi and then Murtha Taila Prayoga. So Amritadi Taila, this is available in the market. It is indicated for Vada Rakta, Rakta Pitta, Shiroroga, Vada Pitta Prakopa. So most commonly it is indicated in Vada Rakta conditions. So the Amrita Kashaya, Guluki is the Kashaya, Chandana, Shariva, Ushira, Kushta, Musta, Dhatri, Ulpala, Shati, etc. These are the Kalka. So coming to the formulations, it is explained that in all instances it is not possible to assess the Phalashruti based on the Avayava. Up to a certain extent you can do, up to a certain extent you can think of the properties of different drugs contained in the formulation. But when a formulation is evolved, it may have some additional benefit. It may have some samudaya prabhava. So that samudaya prabhava also should be taken into consideration. So Amritadi Taila is generally used in Vadarakta spectrum disease of rheumatological disorders. We can use the Amritadi Taila. Generally in RA cases, gout cases, Amritadi Taila is often. Even including the SLE also, Amritadi Taila can be used. Arukaladi Taila, this is nowadays it is very rarely used, especially it is used in Kamila cases. After the initial phases, after all of the treatments over, lastly we apply the Arukaladi Taila over the head and ask the patient to take bath. So this is especially it is indicated for Kamila cases. Jwaram, Rajayakshma, Kamila, Pandu, it is in Priya Tarpana. So in the post-pyroxyl period, in other conditions also you can take. In the post-pyroxyl period, Arukaladi can be offered. Then post-chemotherapy cases also, there are some studies on Arukaladi, which is found to be effective in post-chemotherapy cases. Then post-TB, post-hepatitis cases. Asvanamanjishtadi, there is a Taila called Asnavilyadi, Asnavilyabalamrata Bajide. So that Kashaya is taken. The Kashaya of Asnavilyadi Taila is taken. In that Manjishtadi Taila, the kalka is that of the medicines of Manjishtadi Taila. So these are mixed. So the kashaya from Asnavilyadi Taila and kalka from Manjishtadi Taila. So these are mixed and a new product is formed. It is generally used in Kapha Pitta, Rekta, Koba cases. Just an example, diabetic retinopathy type of cases, Asna Manjishtadi Taila is also. Asna Eladi Yamaga. Here again, the kashaya is the same. Asana Vilya Bala Amrita. That is the kashaya. In that, the swarasa of Nili, Surasa, Durva, Dhatura Patra, etc. is added. And as Kalka, Eladi Gana is. It is called as Yamaga since it contains Kera Taila and Tila Taila. So the base is Kera Taila plus Tila Taila. Okay. So some oil and coconut oil, both are taken. So since two oils are there, in Kerala they call it as Yamaka. As far as the classics concerned, Sarpis Taila Vasamaja, if any of two are mixed, that is called as Yamaka. But in Kerala market you can have Yamaka preparations which may be containing two type of oil only. So here Kera Taila and Tila Taila is the base. So that is called as Asneladi Yamaga. It is very commonly used in dandruff cases, itches over the scalp, lice, skin diseases of scalp, etc. Even for Dhara, this Asneladi Yamaga is used. In cases of dandruff, it is found to be very effective. Asneladi Yamaga. Ashtapatradi Kera Taila, this is only for Murtha Taila application it is used. For Shirodhara, this Ashtapatradi Taila is used. It's a formulation from Malayalam text. In Balavisarpa cases, this Ashtapatradi Taila is used. Contains Madhusnoki, Yashtinadu, etc. Dhatura Patra Swarasa, then Tamula Swarasa, then Tulasi Swarasa, etc. It contains. Along with that, Madhusnoki and Yashtinadu is also added. It is indicated in Balavisarpa cases. Palaguluchadi Taila is a common product in Kerala. In almost all hospitals, you will get the Palaguluchadi Taila. Palaguluji Devadaru, that's the Kashaya. Jadamayadi, that is the Kalka. Both the Taila and Kera Taila available. Palaguluchadi Kera Taila is also available. Palaguluchadi Taila is also available. So the indication is Vadashonita with the Daha Shula Shosa. This is a very common product used in Vadrakta cases. Baladhatriyadi Taila, the references from Sahasra Yoga, Shiro Netraga Roga, Vada Pitta Kova, Angadaha, Kshadakshaya, Rektamamsa Balaprada. So in the indication it is explained as Rektamamsa Balaprada. So that should be, that is very important. So it is a huge formulation, Baladhatri, Guluji, Ushira, Trivera, Chandara, Yashti, etc. that is made into Kashayam. Madhuga, Chandara, Kushtovilpala, Shariba, Jadi, Phala, etc. they are made into Kalka. Then Shira contains Shira, Amalagi Rasa, Sadavati Rasa, etc. Very commonly it is used in alcoholic neuropathy cases, alcoholism, the de-addiction cases also, when there is derangements in the sleep, night dreams, etc. Baladhatri Taila is used. Balahadadi Taila, this is from Chilsa Manjari. Bala, Amalaga, Mugga, Guluji, etc. Then Chandana, Kushta, Yashti, that is the Kalka, and Tila Taila is the base. It is indicated in Shiras Shula. Even in migraine cases, when it does not subside with other medicines, oil is changed, head oil is changed. In that case, generally Balahadadi Taila is used. Coming to Bhujagaladadi Taila, Bhujagaladadi Taila, it is specifically indicated in Kesishana. Kapha Pitta Shamana, Shiroruja, Shiro Kandu, Kata Shasana. We had a work on Bhujagaladadi Taila as Piju in Kesishana. It was found to be highly effective. Bhujagaladadi Taila. Brihad Balaguluchadi Taila. This it is somewhat similar to Balaguluchadi Taila, but it contains more drugs like Karaskaramula, etc. So Prakshepa, Ahifena is added as the Prakshepa. Then specifically in Vadarakta cases, Brihad Balaguluchadi Taila is very commonly used. It's found to be effective, especially when to prevent this Murta Taila. Brihad Narkutyadi Taila, it is indicated in Abaji, Pinasa, Pudi, Garna, etc. Baja, Haridagi, Laksha, Kadirokini Chandani, Narkundi, Surase, Sitham, Tailam, Ashavajin Jayat. This is from Ashtanga, Hridaya, Uttarasthana, Abaji Pradesh. Chandanadi, everybody will be knowing. There are two formulations. The small one that is indicated in Vadarakta, whereas the Valiya Chandanadi, big Chandanadi Taila is indicated in Chitta Bhramsa, Kamila, Murcha, Visattva, etc. Dharanaga Taila, which is specially indicated for Dharanaga, which contains Pancha Tiktaga, then Durdura Patra, Tambula Patra, Nili Patra, Krishna Tulasi Patra, Durva, Swarasa. And along with that, Eladi is added as Kalpa. So that is the Dharanaga Taila, which is specifically indicated in Dharanaga. Dhanandaran Taila, which is a very common one. Balamula Kashayasya Bhaga Shapayasastada, that is the formulation here we get as Dhanandaran Taila. Sodiga Bala Marmasti Hadakshineshu Pujan, that is the Parasruti. So it is specifically indicated in Vada in general, then Sudiga, Marma, Asti, Hada, Jara, Yoni, Yoga, etc. So in many cases of traumatic cases, this Dhanantara Taila is very commonly used. Himasagara Taila, you can see the Balasruti falling from height, falling from elephant, horse, camel, etc. Monoatrophy or diffuse atrophy, nasal voice, lalla jigwa, etc. There are some specific indications. This should be read very carefully. Karpasastyadi, again, which is a very common formulation used in hospitals. References to Sastra Yoga, Karpasasti Bala, Mashapulatha, Devadaru, Rasana, Pushta, Sarshabu, etc. The yoga is from Sastra Yoga. So it is indicated in Ababhaga, Ardhida, Panchakarma cases. Ababhaga cases, especially the cervical spondylosis cases, Ababhaga, this Karpasasti Taila is used for Nasya, Abhyanga, Shirasega, etc. Then in Ardhida also it is indicated. So very commonly in facial palsy cases, Karpasasti Taila is used for Shirodhara, Shirasega, Nasya, etc. Then in Panchakarma also it has some specific indication. Karpasasti Taila has some specific indication. Coming to Mahamarsha Taila, Mahamarsha Taila, Sastra Yoga contains many Mahamarsha Taila Yoga. It is indicated in Pakshaghada, Ardhida, Kampa, Vadhidya, Nirudrasya, etc. So in convulsive movement disorders, generally Mahamarsha Taila is first thought. Okay. In Ardhida cases, Pakshaghada cases also, this is very commonly used. Maricha Taila, the usage is very minimum, especially for tonsillitis, thyroid enlargement, nasal blockage, etc. Marichadi Taila is found to be more useful. Not in the acute stages of tonsillitis. Once it is subsided, you can practice the Marichadi Taila overnight. Nimba Taila, Padola Nimbapatra Swarasa, Haridra Kushta Kalka, Naligara Shira Tila, and the Kara Taila. It is indicated in Kabbalah verses. Nimba Murdadi Erinda Taila, the formulation is that of Gugula Tiktaga, but the base is Erinda Taila. So that is the Nimba Murdadi Erinda Taila, which is freely available in Kerala market. And this has been indicated in Vadarakta, Kushta, Buddha, Nadi, Prana, Vitardi, etc. In almost all cases, wherever Gugulta is indicated, Nimbamurdadi Erinda Taila can be used. Apart from that, when the patient present that he cannot use any oil over the head. Whenever they use the oil, they developed some unusual features. So in those cases, to prevent that, to make the patient satmya with the oil, we generally add Nimbabudadi Erinda Taila into the oil. So suppose the patient is in a condition where Karpasastita Taila has to be used, but the patient is not fit for Murta Taila, or the patient has some problems. So in those cases, generally we mix the Nimbabudadi Erinda Taila along with the Karpasastita. Generally it works very well. Coming to Nishkalkan Enna, this is somewhat similar to the Balakadadi Enna. Bala, Shunti, Mudga, Buluji, Masha, Dutta Taila, which is indicated in Shirasula. Nisho Shiradi, which is indicated in Pramehacha, Vrana, points of scarf, insomnia, lacetate, etc. Nisho Shiradi Taila is Panjamuladi Yamaga is from Ashtanga Sangraha, Uttarasthana, which is indicated in Shirasula. Padola Kaira Grada, it's nothing but the Padola the Gana in allergic skin manifestations. Padola the Kaira Taila can be used. Prabondariga, everybody will be knowing, which is from Ashtanga Hruday Uttarasthana, premature graying and all Shirodhara is indicated. All Shirodhara means wherever Pitta is indicated, Prabondariga Taila will be used. Coming to Rasa Taila, this is also very important in Kerala market, where basically the formulation is that of Karpasastiti Taila. In that they have added Ajacidas also, so that it will be more Brahmana. So it is indicated in Pakshaghada, Apavagu, Ardida, etc. This is very commonly used in Kerala practice. Sin Shuddha Durvadi Kaira Taila, which is indicated in Bala Visarpa. Shankhavushpadi Taila, there is a formulation called the Shankhavushpadi Taila, which is found to be somewhat useful in Smrtinasha cases, Alzheimer's disease, etc. Tegraja Taila, where the Brangaraja Swarasa and Abhaya Kalka is there, this has to be made into oil, and that can prevent the Shwasa and the Kasa, like that it is mentioned. Tegraja Taila. Prabhaladi Taila, especially for cervical spondylosis cases, Prabhaladi Taila found to be more useful. Shiroroga, Pradishaya, Khalitya, Palitya, Keshapanjana. In those conditions, Prabhaladi Taila is indicated. Coming to Vadashani Taila, all these formulations are available in market. Vadashani has a specific role in treating Prameha, Pangu, Khanja, Jihva Stambha, Vathidya, etc. So Vadashani is found to be very useful in these conditions. So Vadashani has a specific indication for Prameha, Janya Vyadhi. Pillum Parchotyadi, this is especially it is indicated in Shirodhara. See, there are some multiple products in the same label. In the Kerala market, you will get more than one formulation in the same name. So this is a issue in our pharmacies. Durdura Patradi, Durdura Patra Sarasa, Durdura Bija, that is one formulation. It is indicated in dandruff, Kandu, Kaishituti, etc. This is applied. There is another formulation which contains more drugs like Durdura Patra, Durva, Guluji, Kimchuka, Sarasa, Kushta, Mustayela, Madhuka Kalka, and Naligate cheese. This is indicated in Bala Visarpa. Durvadi Kaira Taila, again it is indicated in Bala Visarpa. Yes, this is Durva Sarasa, Yeshti, Parandi, Krishna Jiraga. Here Durva Sarasa, Nimba Uttara Sarasa, Yeshti, Naligate. So there is some difference in the combination. Narkundyadi Taila, again it is indicated in Shirodhara, Shavatu, Penasa, Nidra, Nasha, etc. The other one, that is Vajahari, the Gilaksha, Kadilokini Chandani, Nargundi, Swarase, Siddham, Tailam, Ashwabajim Jail. That formulation is also available as Nargundyadi Taila. Rasnadi Taila, this is very important. Rasnadi Taila, Tailam Turasna, Dashamula Yeshti, then Baladvaya, Yeshti Kalka. This is specifically indicated in Ardita. Okay, this formulation is indicated in Ardita, which is called as Rasnadi Daila, and it can be used in trigeminal neuralgia, Avakshagata, Ardita, etc. And the other one is Villa Narkundi Patrasvarasa. Villa Narkundi Patrasvarasa. In that, Rasnadi Churna is made into Kalka. So this is very rare. So Rasnadi Churna is made into Kalka, and that can be used over the head when there is Venasa or Jaladosha. See, it's not only in Ayurveda, but in modern pharmacy, modern market also, you will get two different products in the same name. Okay, one is the diclofenac potassium, and the other one is pantoprazole plus domperidone. Okay, the name is Pepti, so the indication is different. So it's not only our problem, in all sectors it is there. Okay. So coming to conclude, Murtha Daila, it's an area reflecting Kerala contributions. Many vast references of different oils are seen in Kerala textbooks, and the transcranial route, effective and convenient route of drug administration, say best route of drug administration, and the scope of transcranial route administration is unlimited. And when we go to the formulations, we have to analyze its properties, whether it is Ushna, Shida, Anushna, Shida, etc. That should be taken into account, and based on that only we can decide the formulations. And it's a treasure of traditional knowledge about the clinical conditions and their management. And all these formulations need comprehensive analysis. With that, I would like to conclude the session. I have not touched the theories behind the Murtha Daila. That will take a lot of time. So only just the operative procedure and different formulations used in the common practice that I have just given a basic knowledge regarding this. So with this, I would like to conclude my speech. Thank you. Thank you all.
Thank you so much, sir. Now the session is open for discussion. If participant has any queries, you can put your question in the comment box. Sir, there are some queries. First one is, in any condition, can we do in prone lying position of Shirodhara?
Sorry?
Sir, first query was, in any disease condition, can we do the procedure in prone position?
So far, I don't have any experience with that. Only in supine position it is carried out. That area is very important.
Sir, next query is, if there is Kabhanubandha in Shirsha, then can we go for Shirodhara?
I couldn't get.
Sir, if there is any Kabhanubandha disease in Shiras, can we do the procedure Shirodhara?
This basically comes in the theory. I told that when we talk about the Murtha Daila, it shows that Vada has the predominance. See, if the Anubandha is more, or if Anubandha is equal to Vada dosha, you have to treat the Anubandha dosha first. As I told, if there is a Sama condition or if there is any association of dosha, that should be treated first. Then there is a stage comes where the Anubandha dosha is over. Okay, but still, see, Prameha. Prameha is a Kapha Bahudrava Shleshma is the causative factor for Prameha. So in all Prameha, it may have some relation to Kapha. Okay. So whenever we select a formulation, it should be Vata Kapha. So in this case also, first you have to treat if the Kapha Prakopa is more, or if it is Pratyaksha, then you have to treat for Kapha first. Once the most of the symptoms over, you can go for Dhara, that also with the Vata Kapha drugs on. Am I clear?
Yes, sir, clear. Sir, next question is, why Shirodhara is not indicated in first stages of disease?
The same answer. That is in the generally when we take the definition of Ama, Prathamam dosha dushtincha kejidamam prajakshade. So the first phase of dosha dushti is taken as Sama. So there is a concept like that. So initially you have to consider whether it is Sama or Nirama. Then where is the dosha? Okay, if the dosha is in the Shiras itself, you have to make sure that there is no association of other doshas. All srodhasas are clear. In such a state, you can directly go for Shirodhara. But it is not usually seen. When a samprapti occurs, it will have some sort of srodhodosha, srodhodushti. So initially that has to be corrected. That's what I told. Minimum do some nasya, then go for dhara.
Clear, sir. Sir, next query is, why Rasnadi Churna is applied after the end of procedure?
This to prevent any sort of this in Malayalam it is called as Needarakka. Sometimes if it persists, there can be some problems. See, there is a chance for this there is a particular doshagati explained in the text, that is from Urdhva Desha, from the head. Sometimes there can be some dislodgement of dosha to the lower part of the body. There are some conditions explained like that. So where the Kapha Pitta Kopa along with the Vata is there. So Kapha Pitta Kopa occurs in the head, and the Vata take this Kapha Pitta to the lower parts of the body, and somewhere it gets lodged and produces disease. So this is a concept explained in some text. So to prevent that, this Tala is applied. Shiroleba is applied. The same principle here it is also taken. To prevent any sort of this type of doshagati, it is better to apply Rasnadi Churna over the head. It need not be the Rasnadi Churna, even in some cases some Bhasma also it is applied. Or according to the case also you can change. Generally, Rasnadi Churna is Vata Kapha, that is why it is taken.
I think there are no more queries, sir. So we are going to conclude this session with vote of thanks. First and foremost, I would like to thank Dr. Jigeesh sir for informing us with his vast expertise. Personally, this is a proudful moment for me because sir was my HOD and guide during PG. Still, he is my guide. Then sir has explained the details of Shirodhara from the beginning of the evolution to the current method of practice, along with the medicine, different kinds of medicine we can use in the Shirodhara. Thank you so much, sir. Next, I would like to extend my gratitude towards Dr. Shyam Bakre sir, Principal of MES Ayurveda Mahavidyalaya, and Dr. Sachin Utpat sir, Vice Principal of MES Ayurveda Mahavidyalaya, for their supporting organizing the program. I also thank the whole Panchakarma department especially Dr. Vishali Swami Madam, the head of the department. I would also appreciate Dr. Sayesh Joshi sir and Dr. Nainesh Kamble sir for their technical support. Last but not least, I would extend my thanks to all the participants who were patiently listening this program and actively participating. Thank you all.
Shall I leave?
Yes, sir. You can leave, sir.